David, I want to start out with you were talking about on stage about needing to make some adjustments and talk with payers about reimbursement. And one of the things I want to ask you about is your Alzheimer's treatment, donanemab. We saw last week the advisory panel recommend full approval of ESIs and Biogen's. What are you going to do with regard to your submission now, and what's your expectation if you do get full approval?
Yeah, well, great to be with you. Thanks for having me on. We're in an amazing time for invention of new medicines, but as you're pointing out, coverage and reimbursement is a constant fight and topic. Here we have Medicare, or CMS, which has said they're going to require coverage with evidence development, which means you have to basically be in a clinical trial. They haven't spelled out the details of that, and we'll learn more, I think, after the competitor product, lecanemab, is approved. But what we've said is this quarter we'll finish our resubmission based on the full phase 3 results.
And we expect to make it a full approval.
And we expect a full approval by early next year. Yeah. And hopefully, in that time period, the government can find a way to reimburse patients who need this drug for their Alzheimer's treatment.
Have you had discussions with them? They're talking about a registry, and they say that it won't be onerous or impede coverage.
We are. We're skeptical that it won't impede coverage. We've had some experience here. We make the primary PET scan, or the brain scan, used to detect amyloid, which is the hallmark of Alzheimer's. And for 10 years, we've been under coverage with evidence development. And that was purported to be a light study as well. But it's a lot of paperwork for doctors and hospitals. It's a lot of paperwork for families and their caregivers of those who are concerned about their parent or loved one who might have dementia or Alzheimer's. And it's been a barrier to care, particularly in rural America, where they're far away from academic medical centers like here in Boston, or actually for people of color. It's been a barrier. So we don't think that's the way to go. They should just open up coverage.
Another big issue that people have been talking about here at the conference is the IRA, the Inflation Reduction Act, and what that is going to mean for drug development and what it's going to mean in terms of negotiations. Yesterday, Biogen's CEO Chris Viehbacher said it's not a negotiation because essentially you have to take the price or leave it, or they're going to fine you if you don't accept it.
Yeah, I agree with that analysis. I think there's several defects with this law. That's one of them, which is it's called a negotiation. But first of all, we already negotiate for almost all access in Medicare. We just do it with third parties like CVS and United Healthcare. By the way, they do a great job. Our prices are way lower in Medicare than they are in the commercial market. So there already is negotiation. The government wants to step into that and play a bigger role. That's a problem because it's not actually a negotiation. You have to take it or leave it, what their price is. That's not how I think of a business negotiation. But the biggest problem is actually when they propose to negotiate, which is for pills or small molecules, right, as we say, as early as 9 years into a 20-year patent life. Maybe we don't need a full 20 years, but boy, that's going to really truncate investment in what is one of the most efficient parts of healthcare, which is small molecule pills that people can take to cure a previously incurable disease. And once they go generic, they become incredibly cheap. The U.S. has the cheapest generic prices in the world. That's how drugs in healthcare remain sustainable in the U.S. We'll get fewer of them because investors are already saying to me, why would you invest in any new small molecules? Just focus on biologics. They get 13 years before negotiation, air quotes, on negotiation. So work to do to improve this bill. I'm really worried about the harm it's going to do.